Hello everyone, today we're going to be talking about anaerobes and specifically the aerotolerance test. So when we describe anaerobes, we describe them in a few different categories, but I'm going to touch on three. So there are the obligate anaerobes that cannot grow in the presence of oxygen and will surely die during exposure to oxygen, and that's due to the fact that they don't have enzymes that would protect themselves from oxygen or be able to use oxygen in their normal metabolic processes. Then we have the aerotolerant anaerobes, which can grow in a little bit of oxygen and they basically tolerate it. Those organisms may or may not have one of the enzymes in order to be able to tolerate oxygen. And then there are the facultative anaerobes, which we have covered in most of our course because they're mostly the pathogens that you'll find in the clinical arena. And so when we discuss this, or when we look at why we would do the aerotolerance test, it's because anaerobes usually are present in mixed cultures. So that means that once you've grown the specimen on a primary setup with the blood, chocolate McConkey, and then also the anaerobic setup that we've done, and you've seen videos on, there may be growth all throughout. There may be growth that doesn't match the growth in the CO2 setup versus the anaerobic setup. So a lot of times when you have anaerobes growing with, or obligate anaerobes growing with those facultative anaerobes, they look very similar. And so this test is used in order to figure out who's who on the plate, basically. So the setup that we have as the primary setup in a regular primary setup that goes into the CO2 incubator, we have our blood, our chocolate, and our McConkey. Okay, and what we're looking for are various pathogens, depending on the body site, obviously, that would grow specifically on all of them or only some of them. And so we're matching growth with gram stain information and what it is that we're expecting to see due to the body site. So I know what you're thinking. You're looking at this primary setup and thinking, oh my gosh, there isn't any growth. Well, that is because in class we aren't using mixed cultures as specimens. We're just using a pure culture specimen. And so the aerotolerance test isn't actually required in the processes that we're doing in class. However, we teach it so that if the students end up working in a facility that does not have moldy toff, where they're growing it over a 24 or 48 hour period and then throwing it on the moldy top, then they'll be able to understand and know how to use this process in an unautomated micro department. Okay, so when you do pull out your primary setup and you're looking at the growth, and there is mixed growth all over the different plates, what you're going to do is for each different colony, you can subculture and gram stain it if it seems like that may be the pathogenic bacteria. So you can use, you would be using the blood agar plate that was incubated in the CO2 incubator as that part of the primary setup, and you would be using the Brucella blood agar plate from the anaerobic setup. However, if you have a specimen that ended up growing a facultative anaerobe or an organism that had swarming, you would want to end up going to the PEA. Oh, sorry, this is the Brucella blood agar. You would end up going to the PEA if you notice lots of swarming on the Brucella blood agar plate, which could indicate Proteus or Clostridium species. So that way the PEA plate is going to make sure that they don't grow and swarm the obligate anaerobe out. Okay, and so you should also end up using a thioglycolate broth in order to grow any organism that may honestly not be present. This one has a swab in it. I didn't mean to grab that one. So that if you have an organism that maybe is taking a while to grow, because a lot of the anaerobes do grow very slowly and don't immediately grow within that 24-hour period. It may take 48 hours to 72 to a week. You want to make sure that when you put them in the thio, they have this all this broth that is nutritional, and they'll end up growing down towards the bottom to make that anaerobic environment that they want. And you would definitely look at this every day for those 7 days after you started incubating it, in order to figure out if there's any organism there. And you can gram stain it and see if it matches what you've had previously or not with your initial primary setup gram stain. So here, this is an indication of growth. You have a nice, well, maybe you can't see it very well. There's a nice cloud at the bottom. So you see that it's growing down there. And this is from this honestly is a culture swab from making the stock culture. So it's not like you're going to put an actual swab in there. Okay, so let's go ahead and get started. When you do this, you're going to have 2 chocolate plates, okay? And you'll have a Brucella blood agar plate, so that you can end up putting this one in the anaerobic environment with a purity chocolate plate, and then you'll put the chocolate plate for the aerotolerance portion of it into the CO2 incubator. So you can see I've labeled one for CO2 and the other one is for anaerobe. The names that I have on these plates are fake people, but I still don't want to put them on video just in case. So we're going to do, we have unknowns for the class that we're doing right now, and so we're going to do an aerotolerance test for at least one of the specimens on video right now. So the primary setup for this patient specimen ended up having growth on just the anaerobic setup, and you can see the blackening of that Brucella blood agar plate. Okay, so you should pretty much figure out, sorry, not the Brucella blood agar plate, the BBE, the Bacteroides bioescalin agar. And so you should pretty much figure out who that is. But if you look at our aerobic setup, there was nothing. Again, that's because it's from a pure stock culture. In reality, we wouldn't do this on this type of specimen because obviously there is no need, but this is learning, and so we're going to do it to practice. Okay, so we have the 3 plates that we had in the anaerobic setup. We're going to get rid of the gas pack and the indicator that we had previously. It's no use. It's of no use anymore. Everything has been brought to room temperature, including the new plates that we're going to use. So let's look at these plates. So we have our Brucella blood agar plate. We have beautiful growth there. A lot of times when you have a mixed culture plate, you're going to want to use excuse me. You're going to want to use a magnifying glass. We have lamps in here that do have a magnifying glass on it with the light around it, because the reason you would use those is because these grow slowly, so they would be kind of tiny depending on if they're slower growing ones or not. So you can see that this specimen is beta hemolytic, and it is growing on Brucella blood agar plate. we have the BBE on the left side. It's blackened, which is a indication or a preliminary identification of Bacteroides fragilis. We have growth on the LBKV, and this is after I had left this in the incubator for a while so that we did see absolutely beautiful growth. So you would not get this great of growth within 24 hours. Okay, and then we have growth here as well. Okay, so what we're going to end up doing, that was the PEA auger. Okay, what we're going to end up doing is we're going to take from the, sorry, cover up the name. We're going to take from the Brucella blood auger plate and we're going to put it onto this aerotolerance test setup. Okay, so one of them is going to go into the CO2 incubator and the other chocolate is going to be inoculated before the Brucella blood auger plate. So on the CO2 auger, chocolate auger plate, we're not going to stick any of the discs on there. However, in the on the chocolate auger plate, we will be putting some discs on there, although we're just going to put one. The chocolate auger plate that is anaerobically incubated as the purity plate with the Brucella blood auger plate would have your antibiotic discs on there. So these discs would be kanamycin, colistin, like I'm showing you here, and then vancomycin. And those are not used for susceptibility testing. Those are just to help categorize what group of anaerobe it is. And you would want to look at these, the growth around the discs and with the gram stains to help group those organisms. So most of the anaerobes that are going to be in these specimens are going to respond to those frontline antibiotics that the patient would naturally get if depending on what facultative anaerobe is the causative agent of the disease, if that is the case. And so most of the time you're not going to end up having to put it on the Vitek to find susceptibility testing, but there are some indications that you might have to do susceptibility testing of your anaerobes, and those are site-specific. You would end up following your clinical sites or your facilities standard set of operations. But an example of that type of situation would be if the therapy that is being provided to the patient is failing, and maybe that's due to an anaerobe that is very resistant to what is being provided. So then you might want to put that organism on there onto whatever automated analyzer you're using to figure out the susceptibility. Another reason might be if you live in a geographical area where you're trying to monitor those susceptibility patterns to see if you have resistant bacteria emerging in your population, then that would be another indication. So there are a few indications of when you would do that, but it's not usually necessary. So again, the chocolate auger plate, that's the purity plate in the anaerobic incubator, is going to be the one that has those antibiotic discs on there. And the nitrate disc that we're going to put in the excuse me, in the anaerobic incubation bag is going to be on the Brucella blood auger plate. Depending on if you follow the insert or manufacturer, they might say first or second quadrant. Today I'm going to put it in the second quadrant. In another video it was on the first quadrant. It really just depends on what the manufacturer describes that they want, or the textbook that you're following. Okay, the textbook that we have says the second quadrant, so I'm going to go with that so that if students look that up, they're going to be able to follow that procedure. So I'm going to get a beautiful colony here, and it's isolated, it's a pure colony, and we know that all of those are the same anyway, but I'm going to do a line here, a line here, and then a line on the Brucella blot agar plate, and that's to introduce the organism onto the plate. And then I'm going to shake out a new loop, and I'm going to go through and then spread that organism around. So you can see the line there. And now I'm going to make my quadrants here. That's the first. This is the second, the third, and then the fourth. I'm going to continue on, and then we will place the discs on after that. I'm only going to do one specimen because that's really all you need to see. So we have several unknowns that the students are doing right now, and I'm just going to film one aerotolerance test. Okay, again, there aren't any antibiotics or ingredients that I could be transferring through to these plates, but you're doing this order of inoculation because you want to know if the organism did not grow on the Brucella blot agar plate. If you did that purity plate right beforehand, you'll know that it didn't, it wasn't due to lack of organism, because if it grew on this, I think I said it wrong. If it grew on this one, but it didn't grow on the purity plate, then you'll know it's not from lack of organism being there. All right, so now we're going to place the discs. So you're gonna get clean forceps or tweezers, okay? I'm using this one first, and I'm going to put the nitrate disc on first, okay? And so I'm going to pull out, well, that didn't go so well. Let's try that again. I'm gonna pull out one nitrate disc, okay? And I'm going to gently place it on the second quadrant, okay? So there's my second quadrant, making sure it's nicely placed on there so that it's well seated and it's being touched by the agar all around its surface, okay? And so there's that one. I'll clean this one up in a minute. And then what I'm going to do is use the purity plate, the chocolate agar plate, and I'm going to put the colistin disc on there. I only have it open right now because I wanted you to view something. You should not have it open and just sitting there. Okay, so we're going to put the colistin disc into the first quadrant where all of the growth is supposed to be happening. Again, oh nuts. Again, you would put, I'm gonna clean these forceps after. You would put it in the first quadrant, and you would put all the other antibiotic discs there as well. And put them into a anaerobic bag, okay? I'm gonna put the chocolate down in the front, okay? And then the BRUBA. Again, this is a fake person. So we have the indicator that we brought to room temperature, and we also have the gas pack. Let's flip it to English. Okay, anaerobic pouch. All right, so we're going to open this up, put it in there. You've seen other videos, and I have other videos that you can look at on each of the anaerobic organisms that we have in our classroom and what their testing and growth characteristics should be. So we're closing this up nicely. You want to leave a little bit of air in there so that the gas pack can do its job and change the environment, lower the oxygen, and transform it into a high nitrogen and high hydrogen environment. So what I'm going to end up doing is I'll take this and I'm going to put this in a normal O2 incubator, but again, since it's already in the bag and it's got the gas pack and the indicator and it's sealed in there, it should create an anaerobic environment. So we're going to do that. So I've got my O2 incubator. I'll put it up here. All right. I'm going to close it up. And then with that CO2 CO2 plate, I'm going to put it into a holder with the original primary setup. Okay. So the original primary setup is going to go underneath of it. All right. And I'm going to put it into the CO2 incubator. Okay. Put it in there. I'll turn it on. And then I'm also going to do the thio because I forgot to do it since we were talking. Okay, so I'm going to inoculate the thio. All right, so with this, we're going to take it from the Brucella blood agar plate. That is where the growth was, and we don't have any indication of swarming. Okay, so I took it from there. Take your pinky, undo this, and then you're going to slide it in there without touching, and you're going to put it down at the bottom. All right, so that colony should come off your loop, and hopefully once we pull it out and cap it, I'm going to cap it completely tight. All right, I'm going to stick it in the O2 incubator with the other plates, the anaerobic plates. I'm going to put it into a rack, okay? And I'll put it in there with that one so that we can see, even if there isn't any growth on the plate, we can see if it's going to grow into the thio and check that out at the end. All right, well, I hope that you found this helpful. The one thing you do want to remember is that for our class specimens, we have really ones that are going to be testing negative for the aerotolerance test. There are some organisms or some strains of Clostridium, Biophytobacteria, and Propionibacterium, and most of Actinomyces are considered aerotolerant. So they would grow on the CO2 the CO2 incubated chocolate agar plate. But you should see in our classroom, you should see a negative on most of them. We do have a Clostridium species that sometimes plays around like it's aerotolerant and Propionibacterium acne sometimes goes back and forth. It really all depends on the year, honestly. Well, anyway, I hope that you enjoyed this video, and I will see you next time. Thank you so much for watching.